Good evening, everyone. My name is Amanda Thomas, and I would love to welcome you to Science on Tap. We are here tonight for a special talk about Hands Up, Don't Shoot, policing as a public health crisis. And we have three folks who are going to have a discussion with us tonight. We have Dr. Maayan Simkes, who is an epidemiologist. We have Dr. Siri Alang, who is a professor of sociology, and also Dr. Hedy Lee, who is also a professor of sociology. And I'm going to give you some more information about all of them. But first off, I am going to give you just a little bit of background on Science on Tap and what you can expect for this evening. Science on Tap is an event series we've been running for 8 or 9 years and based in Portland, Oregon. And we used to do events in person and hopefully will do again at some point. And our goal is to make science accessible, fun, and meaningful, especially for adults. And if you have not seen one of our events before, or you missed one, or you're interested in one of our podcast episodes, you can check out our YouTube page at Science on Tap ORWA. And this event here will also go up on the YouTube page in the next couple of days. We are recording it. However, if any of you heard this event is being recorded or saw anything about that as you logged on, rest assured you will not show up on camera. It's only me and the panelist who will be there. You won't be on camera and you won't be audible either. So don't worry about that. But do check back, and if you want to share the link in the next couple of days, that this video will be available on there. Tonight's agenda is a little bit different than what we normally do at Science on Tap in that we are going to have a short presentation by our first presenter, Dr. Maayan Simkes, who is an epidemiologist at the Washington State Department of Health. She's going to show some slides, talk a little bit about, give some framework for what the discussion is going to be this evening. And then she's going to finish with that. I am going to come back on screen and I will be joined by our other two presenters, Dr. Siri Alang and Dr. Hedy Lee. And we will have a conversation about the topics that Dr. Simkes has put forward in the topic. And I have lots of questions to ask them during that discussion. And there is time for Q&A for all of you. If you would like to ask some questions, you are welcome to do that. We'll do that towards the end. I also want to just acknowledge the fact that even though that I'm going to be moderating the talk, I am a white woman, and I'm also not an expert in this field. I'm not an epidemiologist. I'm not a sociologist. And I'm really looking forward to hearing what our experts have to say. They have generously provided me with some topics in advance that I can use as prompts for the conversation. And again, we will have time for questions and answers. And I'm looking forward to learning with the rest of you as well. And with that, I'm going to stop sharing my screen and introduce our speaker, our first speaker of the evening. And welcome to the stage, Dr. Simkes. Okay, let me do just a brief introduction. Dr. Maayan Simkes is an epidemiologist at the Washington State Department of Health. She's also the primary author of the paper, The Adverse Effects of Policing on Population Health, a Conceptual Model. And we will be discussing that at some length this evening. Also, some of you longtime Science on Tap listeners or viewers may recognize her from appearances at several previous events. And I want to say thank you, especially so that she has put this panel together. So welcome, Dr. Simkes, and take it away.
Terrific. Thank you. And thank you, Amanda, for having me back yet again. And for everybody who has to listen to my voice again, thank you for being here. As Amanda said, my name is Maayan Simkes. I use she, her pronouns, and I'm an epidemiologist in Washington State. While Amanda did recognize that I work for the State Department of Health, I am here today representing myself. And today we'll be talking about policing as a public health crisis. And this is a topic that I spent several years now studying. And I'm really excited to be here sharing with you all today. I'll start by sharing that I'm joining from the traditional lands of the Puyallup tribe, known in the Twilshutzee language as the people from the bend at the bottom of the river. The Puyallup people have lived in this region for thousands of years, long before white Europeans colonized the land and forced the Puyallup people and neighboring tribes onto small reservations, stripping them of their ancestral rights and homes. Despite this devastation and years of war to defend their rights against white settlers, The Puyallup tribe continues today to uphold their traditional values, practices, and sovereignty. I'm a guest on these lands, and I thank the generosity of the Puyallup people and elders for allowing me to live and work within their ancestral home. I recognize that this acknowledgement is a very small step in the direction of allyship and justice, and that we must also commit ourselves to uplifting the histories, experiences, and voices of the Indigenous people of these lands. As we meet in this virtual space, we each sit on the traditional lands of different Native peoples, and I encourage each of us to acknowledge, learn about, and honor those peoples. While we're in this space of pause, I'll also ask us each to check our privilege. And I'll start with myself. I'm a white woman. I grew up in middle-class homes. I went to college, and I have 2 graduate degrees. That should tell you quite a lot about the privilege that I carry. Privilege colors the way that we see the world. And as we enter into a conversation about policing and health, it's really quite important to recognize my own privilege, because I don't look like the people who are most affected by the work we're discussing today, by the problems we're discussing today. And though I've chosen to study this, and I have dedicated years to doing this research and this work in this very challenging space, I still carry that privilege with me. And I want to acknowledge it as we get started. And thanks to Amanda for doing the same. So why are we talking about policing at a science event? That's a question that I was expecting to hear from somebody, but I have a feeling folks are excited to be here, and that makes me happy too. But why are we talking about this at a science event? And I have faced that question a lot over the years. Let's start with the basics. So violence is a major public health problem. In fact, just in 2017 alone, in the US, 7 people per hour died of a violent death. And over 19,000 people died by homicide in that year. And over 47,000 people died by suicide. Each of those deaths contributed to over $90 billion of lost income, of lost medical care funds and lost work alone. And that doesn't even count for the legal fees. It doesn't count for the costs in the criminal justice system associated with each of these events. It's a tremendous burden on our society, violence, but it's not something we talk about sufficiently, and we don't really discuss the complexities underneath it. So deaths are really just the tip of the violence iceberg. I know everyone's tired of this metaphor. You've heard it 1,000 times, but bear with me because it really works for this conversation. So deaths are just the tip of the violence iceberg because there are so many other types of violence that happen before, that happen more frequently, and that we don't talk about. Abuse and neglect, sexual violence, elder abuse, emotional violence, intimate partner violence, firearm violence. These are all forms of violence that don't necessarily lead to death, and they are each and every one challenging to understand, challenging to talk about. They often don't get reported, so they're very hard to track and quantify. Police-related violence is perhaps more complicated than everything else I showed you on that last slide. Why is violence caused by police or associated with law enforcement so much more complex than other types of violence? Well, not all interactions with law enforcement lead to physical violence, though some can lead to physical injury and some definitely do lead to death. But that's not all. There's also a legal element. Anytime there is a negative encounter between law enforcement and a community member or a community event, there's some legal component that so often gets talked about. And the court of public opinion is a challenging place to be. When we see an event where law enforcement and the community interact, especially if it's a negative event or a negative encounter, there are going to be opinions on it. On social media, it'll be your cousin Fred or that neighbor that you don't like to talk to, that person from high school that you definitely want to unfriend and should have done it a while ago, right? But that court of public opinion can have its own effects on us as well. And we'll get into that a bit more this evening. The effects of just a single police encounter can reverberate across people, place, and time. And yet, or perhaps as a result, it is so hard to measure. There is no reliable federal tracking of deaths caused by police. I'm going to say that one more time. In the United States, we do not have a reliable way at the federal level to track deaths caused by police. In fact, a new paper was released today in The Lancet, a very prominent scientific journal, repeating and sort of supporting the findings that we've known for a number of years, that our vital statistics, so death records, birth records, right? Our death records in the United States miss at least 50% of true deaths caused by law enforcement. Non-fatal violent encounters also happen as well. People who are injured or experience another negative outcome when they're interacting with law enforcement, those aren't tracked reliably. And non-violent encounters, perhaps those that are just verbally aggressive or those that are positive, like helping somebody cross the street or somebody who attends a drug take-back program run by a police department, those aren't tracked either. So let's think internationally for a minute. In the US, police kill civilians at a much, much higher rate than other comparable wealthy countries. So for every 10 million people who live in the United States, law enforcement kill about 33.5 people per year. Now, if you look at Canada, if you look at Australia and the Netherlands and the rest of these wealthy countries on this list, those numbers are dramatically smaller. We're looking at threefold more deaths in the United States caused by law enforcement. And if we zoom in on who's actually dying, it's also a tremendous inequity. Black people are substantially more likely to be killed by police. In fact, data in this case from Mapping Police Violence, a terrific organization that tracks deaths caused by police, they have found that Black individuals are 3 times more likely to be killed by police than white people. 3 times more likely. And among people who die, Black people are 1.3 times more likely to be unarmed than white people. So take a step back and reflect. Black individuals in this country are 3 times more likely to die at the hands of a law enforcement official than white individuals, but they're also 1.3 times less likely to be armed if they are killed by police. So back to our lovely iceberg. Deaths are just the tip of the iceberg for police-related violence too. You know, I spoke earlier about privilege. Underneath the iceberg, bottom half here, bottom chunk, this is a really important area to pay attention to, and this is where we're going to spend a lot of our time today. I spoke earlier about privilege. There are those who do not have the privilege of ignoring that yellow box, of ignoring all of the negative and adverse outcomes of police encounters that aren't deaths, all the ones that aren't fatal. There are people who can't ignore that yellow box. There are people whose lives are the yellow box. With my own privilege, I don't have to live in this yellow box. I don't have to pay attention to it. But as a doctoral student, I made the very deliberate choice to make that yellow box my business. And I did my doctoral research sitting right on that iceberg, trying to understand that complex overlap of policing and health. And it was an upward battle, and it was challenging. And I'm glad that I did the work and that I continue to do this work, because I am one of those people who doesn't have to be in this box, but I choose to be. Now, spoiler alert, when I did my dissertation work, we found that deaths caused by police, but also other factors, again, are terribly measured. We saw again today in our new literature that came out in The Lancet that once again, deaths caused by police are terribly measured and tracked. Imagine what happens in that yellow box. There's no way that we're going to measure everything that happens in that yellow box. Over the next 8 minutes, I'm going to try to describe for you what's in that yellow box. I'm going to share a conceptual model or a map of how policing and population health are related to each other. And hopefully this will give us some common terminology. It'll introduce you to some of the ideas that we're going to discuss too throughout the rest of the evening as we bring on our lovely, terrific panelists. So join me in the yellow box for a minute. Bear with me. I'm going to go step by step with you. Okay, policing and population health are related to each other, but you see arrows that are pointing to each other here. And that's because policing affects population health, but the health of a population also affects how that population is policed. Everything that you're going to see in this model is cyclic. There are going to be a lot of arrows, and that's because everything is related to everything else in this model. It's complex. A conceptual model or a conceptual framework is trying to help us understand a complex issue. And that's okay. It's not always going to be easy to follow. The point is to take from it what you can to support the work that you do, the knowledge that you are trying to gain. So the first piece here are the exposures. When we think about police and community, there has to be a point where they overlap. And it could be a police community encounter, a person who interacts with a police officer, let's say at the park or at a protest. It could be on social media or in the news that somebody sees law enforcement being discussed or sees a video from a law enforcement agency or from an encounter that somebody else had. There's also an atmosphere and a tone within the community with regard to that relationship to police. What does it feel like to be a person of a particular identity and background in a community, knowing that the police are there? What is the tone and the atmosphere between these two groups? And it's bidirectional. And then finally, how do law enforcement agencies police different communities? How do they enforce different policies? These are the types of exposures to policing that we expect to see within our society. Now, next up is the mechanisms. This is how an individual or a community or some other level that we'll get to actually interacts with those things. First of all, there's a direct mechanism. I can walk into a grocery store, see a police officer at the counter and have a conversation, be it positive or negative, and that's a personal direct encounter that I am having. But I can also have an indirect encounter where I hear from a family member an experience that they had. My brother calls me and says he was pulled over by an officer. Or I could open up Twitter or Facebook and see a conversation about policing. That's not happening to me directly, but I'm experiencing law enforcement through the eyes or the experiences of somebody else. Another word for this is vicarious trauma, vicarious exposure. And there's a whole body of research that some of my co-authors on this paper have done around vicarious exposure to policing. And we'll dive into that more this evening as well. The next thing is the effects. What are those adverse effects of policing? The effects of policing can be at individual, community, and system levels. They can be in the short and the long term. Tonight, we're talking about adverse experiences. That's not to say that police can't have positive impacts on the community. They certainly can. But today we're talking about the negative effects because this is where change needs to happen. This is what makes it a public health issue. This is what makes it a justice issue. So I acknowledge that there are positive impacts of law enforcement on our communities. And tonight we're going to focus on the adverse effects. So let's zoom in on these green boxes for a moment. All right, so we have individual, community, and system levels. As an individual, if I interact with law enforcement, I could be injured in the short term. I could die in the short term. But also in the long term, I could have an injury that doesn't really show up till later. My blood pressure could rise over time, or I could develop a mental health illness or mental illness like anxiety or post-traumatic stress disorder. I could also change my behavior. I could choose not to walk certain routes home or not to call the police if something happens because I'm concerned about what might occur. And then there's this concept of intergenerational or hereditary transfer of trauma. There's just a whole field called epigenetics, and I encourage you, if you're interested, look up epigenetics and read about it. But essentially, as an individual who experiences a form of trauma, I can embody literally into my genetic code and how my genes are expressed, the experience of that trauma and that stress. And over generations, that can be passed on. And this is an established field of study. I'm not making it up. So please feel free to read some more about epigenetics. This certainly is relevant for policing. Thinking about a community, we have socioeconomic strain, community trauma, and community violence that can happen in both the short and the long term. And in the long term, over time, we start to see patterns of inequity in health outcomes that arise. And that's particularly disturbing as we notice that more and more individuals who have negative encounters with law enforcement will have more and more individual level health effects that are negative, and that will accumulate over time within the community. When we think about systems, it gets a little more complicated. We're thinking about an educational system. We're thinking hospital or healthcare. We're also thinking about the criminal legal system. And the way that communities are policed certainly influences those systems, and those systems in turn will influence how those communities are policed. I'm adding a bunch more arrows. These arrows simply indicate that individuals, communities, and systems each influence each other, and the effects of policing at those levels also influence each other. Okay, we're going to zoom back out. We have our green boxes, we have our blue and our purple. This isn't everything. There's two more layers we're going to talk about. The first is that there are contextual measures that are kind of local. So anytime there's a police or a community encounter, you're going to have individuals who are involved. So if I'm the individual involved, there's me, there's the police officer or the whole force that I'm engaged with. There's my characteristics as a white woman, middle class, living outside of an urban Seattle area. There are the characteristics of the police officer, their sex, their gender identity, their race and ethnicity, their age. But there are also characteristics of the situation. Are we meeting at a crosswalk? Are we meeting at a protest? How many officers are there? How many people am I with? What are they wearing? What am I wearing? What are they yelling? What am I yelling? So a lot of situational characteristics here that matter. There's also the organizational history and culture of police departments. That is a complex area in which I've spent some time doing some research. And there's quite a lot to talk about the idea of professionalism, of militarization, and how these things influence how law enforcement interact with communities. Let's zoom out one more level to broader contextual factors. What else matters? Well, in the United States, we have a very challenging history when it comes to law enforcement and policing. The roots of policing are entrenched in our deepest historical patterns of racism and of slavery. Understanding that historical and the cultural context over time is really important for understanding the effects of policing on health. There are also state and local policies that affect how law enforcement actually enforces policies. In some places, things are enforced very differently than in others. In some communities, there may be a quota for officers for doing certain types of arrests. In others, there may not be. And then there are state and local crime and violence. It gets very complicated when we talk about violence because a lot of individuals will automatically assume that communities get policed more when there is more violence. When in reality, we find that oftentimes there is more violence simply because police are there more often. They're identifying it more, meaning these two communities, one that's policed heavily and one that's not, may have the same amount of violence and crime. So it's a little challenging to think about that contextually. But again, all of these arrows go in and out because all of this is cyclic. This entire map is complex because the issues are complex. We designed it to be this way. And if you're interested in learning more about it, I very much encourage you to read our paper. It's not too long, The Adverse Effects of Policing on Population Health. My co-authors and I do not get any money if you go to buy this article, and we don't want you to buy it. You don't need to. Just so you know, people who do research, we don't get paid when you go buy the article. That just goes to the journal. Generally, just reach out to the person who wrote the paper. There's usually an email in there for the person who's the primary contact, and they'll be happy to send you a PDF. So if you don't have access to Social Science and Medicine, the journal where this was published in June, you can email Science on Tap and they will happily send you a PDF copy. So we're going to shift gears, and I am so honored to bring back Amanda to invite and introduce two of the people who really helped to inspire and guide quite a lot of the work that I did in my own doctoral studies. I have cited these folks copiously in my own work, and I am so grateful that they agreed to join and have this conversation with us tonight. So Amanda, I'll let you introduce our guests.
Excellent. Thank you, Maayan. I would like to invite our other speakers on the stage. We have Dr. Siri Alang. Dr. Siri Alang is an associate professor of sociology and health, medicine, and society at Lehigh University. Her most recent research examines how police brutality shapes health outcomes among communities disproportionately exposed to racialized policing. And our next guest is Dr. Hedy Lee. And Dr. Lee is a professor of sociology and co-director of the Center for the Study of Race, Ethnicity, and Equity at Washington University in St. Louis. And I'd love to welcome all three of our panelists to the stage. Thank you all for being here. So I would like to start with a question about why does it matter if we call policing a public health issue? You talked about this a little bit in your introduction, Dr. Simkis, but can you talk about that a little bit more? Perhaps Dr. Lee, if you want to start us out with that.
Yeah, sure. So I thank you for inviting me to this. I'm really excited to talk about this really important issue. And I was also excited to see there are people from Philadelphia, or at least the Philadelphia area, that were putting their zip codes in there. I saw some, I think it was like Allentown and Bala Cynwyd, and I'm from West Philadelphia, but close to the city line, so I know that area pretty well. So I just want to say hi to those people in particular. But so I think Mayan did a really great job of, I hope, sharing with all of you that we should definitely think about policing as a public health issue. There's many ways we can think about how policing might intersect with health. I mean, the first one is always the most obvious, right? Is we often think about, many of us, if we watch the news at all, police involved deaths, right? So we know that there are ways in which people who interact with the police are sometimes killed. And of course, the US is an outlier. We kill more people in terms of contact with police than any other comparable country by leaps and bounds. This is problematic and something that many people talk about as an issue in and of itself, right? So we can think about policing and health in terms of like basic mortality relationships. And then I think Mayan also talked about, but anyway, so I will not refer to you for your first name after this.
Seems great. No
okay.
problem.
Okay. Also talked about the ways in which we can think about how policing can also impact other forms of health, right? So we can think about mental health, the ways in which, even if you've been stopped by police before, how that might impact how safe you feel navigating different neighborhoods. It might create vigilance and worry about, the next time you might have an interaction with police. If you know that you have a family member or a close friend, or see somebody in your neighborhood who have had sort of interactions by the police, that can also impact your mental health. So there's ways in which we can think about mental health. We can also think about other sort of physical health outcomes related to maybe aggressive encounters with police that also happen. And then, I would love to hear what Dr. Lang has to say, but another issue that we have to think about as well is even just sort of practical ways in which policing might impact health. So we talk about how maybe somebody might take a different route if they know they're being stopped by police in one particular route, but there's lots of work to show that some people they just forego walking to places, right? So they might be driving to the grocery store or other places. So there are ways in which just like basic sort of preventative health behaviors that we try to promote are reduced because of high policing. So I think there's many ways we can think about how policing impacts health. Even if you've never had an encounter with police, you just live in a neighborhood that has high levels of policing, or if you know somebody or connected to somebody who has had an aggressive encounter with police. And then Dr. Lang, I know you probably have other things you might want to add, so I'm going to.
Yes, please.
Yeah.
Okay. Well, first off, thank you so much for inviting me and for having me, and thank you, Dr. Simkis and Dr. Lee. So police, a couple of things I would add is that, police brutality, we think about what we call social determinants of health. These are just the things that the ways in which people live, the things that shape how they live, how they grow old, how they die, that, affect resources or shape resources that matter for health, that shape their health outcomes. And policing is one of them, right? In addition to the obvious causing people to die that we've talked about, the fact that people who may not even have experienced police brutality at all, who may never have been stopped by the police, but who constantly see people who look like them killed by the police, make it on the morning news, right? There's that constant anticipation that it could happen to you or it could happen to someone you know. And the fact that, police presence is really rampant in neighborhoods, in schools, wherever, and there's uncertainty, the uncertainty of knowing whether you'd experience police brutality, whether it would be resolved, right? The trauma of that is really a chronic stressor that affects health outcomes. But even just after somebody gets killed by the police or makes it on the morning news, the rest of communities of people who look like them, or even of anybody who really genuinely cares, right? So the reactions to that, the expectation, specifically for Black people, that you carry on with life as usual, right? And then dealing with some of the racist reactions to the killing, right? Why was he running away from the police? Did he or did he not carry a gun, right? And you find yourself defending just the basic humanity of the person that was killed by the police. Is significantly stressful. And of course, the systems Dr. Simkis talked about, policing interactions with the police shape the way that we interact with different systems. I always think about if I get pulled over by the police on my way to work on a college campus, that I don't get to the college campus and like perform my job fully, because I don't cease from being a Black woman that was pulled over by the police once I get into the educational system or once I get into the healthcare system. So the way that I get treated by the police shapes my expectations with other systems, right? And so our experiences with the police affect our health, but then they affect all the other things around us that affect our health.
Dr. Simkis, do you have anything you want to add to this?
I think Drs. Lee and Dr. Ling did a great job, but just I'll say the evidence to back all of these things is really strong. There has been tremendous research that actually measures in communities the rise in depression, for example, in one particular study, among Black pregnant women around the Baltimore area after the death of Freddie Gray, from before and after. They looked at depression, they looked at other health measures, and they saw poorer health outcomes among these women who had no connection to Freddie Gray or to his family, but still experienced those health effects, having been from a community that was affected by just a single event, a single death caused by law enforcement. So imagine all of the people who are affected every year, every day by this. It's tremendous. It's a huge, unmeasured, undermeasured, understudied public health crisis.
Thank you. I was interested in your presentation to the numbers you were talking about, how Black people are 3 times more likely, I believe you said, to be killed by an encounter with the police, and much less likely to, I can't remember the number, but much less likely to be armed. And so I'm wondering what, we talk about deaths being wrong, but somehow there's some quantifiable or not quantifiable, but some difference between if somebody was armed versus unarmed is one. Can you talk about that and what that means?
So I'll speak briefly and then ask my co-panelists to speak, but briefly, no death by law enforcement is acceptable. Every death by law enforcement is preventable. And in public health and in medicine, we are in the business of preventing deaths and preventing negative health outcomes. So in my mind, there is no situation where death should be the first choice. If a person is armed or if a person is unarmed, shouldn't matter. If there are truly circumstances where more people's lives are at risk, it becomes more complex. But if we look at just the simplest individual cases of individuals being killed by police, particularly Black and brown people, it doesn't matter if they're armed or not. They are still at risk. Think about Tamir Rice, and think about Trayvon Martin. Think about folks who, well, Trayvon Martin was not killed by technically a police officer, but we can get into those nuances if y'all like. The point is, there are individuals who are still killed by police, regardless of if they're armed or not, or if they're armed with a real weapon or a toy gun. So there is no case where that is acceptable. The problem is that it comes into play in the legal environment. Did an officer believe that they were at risk or that they were in danger? And the idea of officers' perceived safety comes up a lot in the literature, because it's one of the claims that comes up in legal arguments quite a lot. And we can talk about qualified immunity if folks would like to talk about that. But what I would love to sort of draw people's attention to is that even if an officer says they feel that they are not safe, it doesn't mean it's true. It could just be said to get out of a particularly sticky legal situation. And that's not to say that all officers lie. They don't. But for the argument to be that somebody was armed and therefore it was okay, to me, that's an injustice.
Would either of the other two of you like to chime in on this?
Yeah, I'm gonna. I agree with Dr. Simkis, but I also want to add that for all other kinds of violence, right? Other kinds of violence, other kinds of trauma that is inflicted on communities, that is institutionalized, which police violence is institutionalized because the police is an agent of the state, and we don't necessarily say, oh, you know, this person is a victim of trauma, this person died violently, but let's figure out, you know, did they carry a gun? Was it necessary for them to be killed? There really isn't any situation where a police would kill someone. There are arguments about if the person's life is at risk or if other people's lives are at risk, but we also know of circumstances where people have been heavily armed, right? The case of Dylan Roof, for example, who went into the church in South Carolina and killed people, and he was arrested and he was heavily armed. There's the recent case of Kyle Rittenhouse, was heavily armed. And then we tend to make these arguments about armed Black men, but there are tons of very armed white men that have not been killed by the police. And so it's possible that the police can do their jobs without killing people, and it's unacceptable that anybody is killed. And it's, of course, even more unacceptable that the people who are disproportionately killed, armed or unarmed, are men of color and people of color in general.
Yeah, I mean, I think Dr. Simkis and Dr. Lang kind of covered a lot of things. I think the thing, social science, I think, is tricky because, you know, we have to, you know, in terms of when we do measurement, you know, we're talking about social things that can be, you know, that are, you know, highlighted in the media, that are, you know, part of our culture. And there's a way in which, you know, even when we think about listening to the news, the ideas around innocence, et cetera, come up when you use these kind of like unarmed and armed terminologies. For me, I think the most important, pivotal, and one of the most pivotal things that was said in Dr. Simkis's sort of review of the literature is that we just don't have good data to even understand what's happening. And so this causes a lot of problems, and we can't even say for sure in many cases, you know, who was unarmed and who wasn't armed. We don't even know how many people are being killed. I mean, this is a problem in terms of our data collection. And so while I think it would be great to kind of think through these nuances, I think we just need to do better counting. I'm a demographer. We count and we want to do really good measurement, just like everyone else does. And labs that you want sterilized, we want to be able to like get the best data. And so I also agree. We shouldn't, I don't think this is a good point to dwell on. I think we should be, you know, focusing on the numbers. The most important number is how many people are being killed by police. We don't know. Even their best estimates are probably undercounts, and that's kind of scary to think about. So that's what I would like to focus on more. That's just my comment about that.
I'd like to go on something that Dr. Lee, you just kind of brought up, and about qualified, well, Dr. Simkis, you mentioned this as well, but qualified immunity and body cameras and those kinds of things are, well, the body cameras, my understanding is that those are supposed to protect the public, but those aren't always used. And the qualified immunity is supposed to protect the police if they were feeling threatened. I don't know. Can you talk a little bit about those kind of dynamics? Let's start with Dr. Lee.
No, I think Dr. Simkis could do it because you commented on that first. Or Dr. Lang, because I just went, so I feel like you should.
Either one. Go ahead.
Yeah.
Okay. So I think that there are two pieces here. As Amanda said, it splits. What is meant to help the community, what's meant to help the officers. The whole concept of qualified immunity is very complex in that it is a tool for officers who are facing the legal repercussions of violence in their work to say, but you know what, if I didn't know that there was a constitutional law saying I couldn't actually do this, then it's not really my fault. And it's actually a really twisted argument here that says there has to be legal precedent showing that these individuals acted incorrectly and they should have known it. And qualified immunity has gotten trickier and trickier because of the sort of mess of legal battles that are ongoing regarding these cases, knowing that the vast majority of cases of violence caused by police don't even make it in front of a judge, right? Let alone get discussed publicly. So I think of qualified immunity as just yet another tool in the tool belt of sort of the legal system, the criminal legal system, to make it easier for an institutionally racist structure to continue to practice and to not hold their citizens accountable the same way we hold every other citizen accountable. But the whole idea is to make it so that officers aren't afraid of doing their jobs, that they are not afraid of the legal repercussions of doing their jobs. Presumably that's a good idea, but it has been weaponized in a way that I think is quite unjust. When it comes to body cam footage, the whole idea of body cameras was to make it so that every individual encounter between community and police gets recorded. But body cameras fail. They don't get turned on. There aren't enough of them. They're broken. Some people aren't wearing them. Some people leave them in the car. They're on the dashboard. Sometimes they're not. Sometimes they're on the thing, but they're upside down. Sometimes they get covered by tape quite deliberately. So the whole idea of body cameras is, I hate to keep using the word tricky and complex. It really is quite a difficult situation because while we're getting information, first of all, who's evaluating it? Who's evaluating those data? Who's making the conclusions about those data to help guide our practices? Who's informing the use of those and making the decisions to spend the money on those cameras? And what if the cameras start getting used in reverse to really support, a skewed officer take? And again, none of us here are trying to bash all officers. Our point is simply that these are structures and systems that are in place that are flawed. So there are people who are doing good work looking at body camera footage. And so far, what we do see from those studies is not great, partially because the footage isn't great. Once again, it's a problem with data collection. And a lot of this comes back to a data injustice.
Yeah, and one of the things that I'd like to add with respect to that is things that are legal, that are acceptable by law, can also be bad for public health. It doesn't matter that the qualified immunity. It doesn't matter if a person was armed. It doesn't matter if that by law they had a body camera on or off. That brutality, whether it's state sanctioned, whether it's legal, that it does still have an impact. And the U.S. has a history of things that are legal, that are okay by the law, that are even perceived as ethical, that are at the same time unjust, and that they cause violence and they impact population health. And I think that regardless of how we try to make police brutality seem less violent, or regardless of how we try to account for the nuances or the down the stream, this is a bad police officer that didn't turn on their camera or whatever. Like, I think that the system is fundamentally a violent system, and fixing the little things at the end is just not going to work. It could be, all of these processes could be legal, and people could actually really do them like religiously, but it doesn't stop the fact that it doesn't take away from police brutality as a public health issue and as a source of constant violence and stress to communities that are disproportionately policed.
Yeah, I mean, I think I agree with, I think I agree with the idea that we need to, we have to think about we have to always keep in mind the population health consequences of all kinds of policies and practices across domains. and not just in policing, but especially in policing too, for this conversation. But I think this is a conversation we could have for lots of different systems. If you're a social scientist, this is something that we study all the time. But I do agree. We have to keep that in mind too, because there are lots of institutions that can be helping and also hurting at the same time to communities. And part of being a social scientist or epidemiologist is trying to understand the positives and negative impacts of institutions that are part of our how we govern ourselves, and compare them to other countries. And so we have to be critical so that we can be better, and we can do better, and our country can be better. We are a really rich country, and it doesn't look so if you look at our infant mortality rates or even our, life expectancy. And we have to kind of figure out what's happening in our country that's causing these, differences. And so the first place to look is at these big structures that kind of govern us. That's just my sociology hat on.
And I have to put on my little historian hat for a moment too. The structure of policing in the United States is, as I said before, fraught with racism and has roots in slavery, because the first police forces in the United States on this land that were, governed by white folks, white settlers, were specifically slave patrols. They were responsible for identifying slaves who had escaped and bringing them back. And that was the origin, truly is the origin of our current policing structures that certainly have evolved over time. We have over 18,000 police departments or law enforcement agencies in the United States right now. And they're not all slave patrols, so to speak, but the history is still there. And we haven't really reckoned with the roots of that structure. So how do we modify, evolve, reform something that has such difficult roots that we haven't started to untangle yet?
I am seeing a bunch of questions coming in, and we'll get to the audience Q&A in a minute, but a lot of people are asking a similar question of what we do about it. But I want to identify the problem a little bit more before we get into some solutions. And we've talked a little bit about individual interactions, negative interactions with the police, and how that affects a person. But I'd like you to talk about the communities. So, for example, a police officer stationed in a school, or some sort of a large police presence in a community. Can you talk a little bit about how that affects community members as a whole?
I mean, I know Dr. Lang has better comments about this than I do, but I'll just start quickly. I actually was that was one of the things I was going to mention is, here, like, we've been using the term, police brutality, which I think is, important to bring up. It is an issue that we have to think about in the U.S. context, but but Dr. Simkis talked about sort of different kinds of violence, this idea of, when we think about the word violence, we're thinking about, somebody hurting somebody in some way, usually physically, right? But this idea of structural violence, which is, not just used by social scientists. I mean, Paul Farmer, I guess he's an anthropologist too, uses this term as well. I guess he's been claimed by the anthropologists. I don't know if he is. Dr. Lang can tell me, but we should also be thinking about this term of structural violence. And so when we're thinking about police presence, we know that there's, variation in police presence in communities, and often that level of police presence is not necessarily correlated with levels of sort of crime, and I'm just going to put that in quotation marks, that is occurring in those communities. And so you have to wonder, and I think especially the school example, what does it mean to be in a school, or to be in a place where you're trying to live, learn, where you see police, like, what does that mean about you as a person? To have to see that every single day. And so there's a way in which, we talk about like this fast death, right? Like something that happens to you quickly, but there's a way like this slowly things can impact you. How does that impact your morale, your sense of self? And so we can think about communities that are over-policed. What does it mean to be in a community where you're riding your bike and you're always seeing police officers? How safe do you feel there? Not even just in terms of like your other community members and how connected you feel to them, but also in terms of what does that mean for yourself as a person? Are you going to get stopped by the police? So I think when we're thinking about, when we talk about policing, it's not just about these really sort of negative events that we see on TV, but just the fact that certain communities are devalued and seen as problematic just by the ways in which there's higher levels of police presence, when it is not often correlated with what's actually happening in that community. And then how that sort of gets internalized is something that we don't think about, but can impact populations in important ways. And the measurement of that is really hard to do, and it's kind of a long-term sort of question, like in terms of modeling. And for those of us who care about causal modeling, that's really hard, but it's something we really have to think about, and it's not something that's talked about. But so I just wanted to make that point a little bit stronger. And Dr. Lang, I'm sure you have more to say.
Yeah, thank you, Dr. Lee. And also the anthropologist claimed Paul Farmer. I have anthropologist friends that they're like, oh, Paul Farmer is an anthropologist. So police brutality, when we think about police brutality, we all think about police violence. We think about George Floyd, we think about Breonna Taylor, we think about Philando Castile. That's what comes to people's minds when they think about police brutality. But it's beyond that, right? It includes emotional, psychological intimidation. It even includes sexual violence. It includes neglect. Right? Mm-hmm. But communities that are disproportionately exposed to police brutality, police presence in schools, in neighborhoods, in hospitals. I read a study about a year ago that talked about how patients of color and their family members are actually more likely to have the hospital, right, call police or the security on them than white patients. So that there really is no safe space where there isn't constant police presence that reinforces to people that there might be something wrong with them or there might be something wrong with their neighborhoods. But we've known a long time that, communities that are disproportionately policed or have a high police presence mistrust the police. But then those communities mistrust other institutions as well, because that's really how structural racism works. Our experiences in one system shape our expectations of our experiences in other systems. But it also takes away from communities. It takes away time and resources that matter for health, right? Think about all of the protests, and it's not just the protests, but it's also the fact that the ways in which people protest and the ways in which people grieve are also policed, and that takes away resources. It chips in, like it harms people emotionally, but it takes away money. It takes away time. It takes away time that people spend with their families. A lot of us here had all kinds of conversations after George Floyd died, like time that we could have been caring for our families because of COVID-19. We are talking about police brutality. We are talking about harm while at the same time grieving. It significantly disempowers communities. But part of the problem too is that police typically in the US respond to what I would call indicators of systemic inequalities. Right? Most of their calls are about homelessness, about domestic violence, about poverty, about mental health problems that are just essentially indicators of structural inequalities. And so neighborhoods that are disproportionately policed are also neighborhoods that are significantly marginalized because of our racist systems, because of the way that racism has shaped resources in different communities. And police brutality is now just another extra hand or extra arm of racism that is marginalizing communities. So it doesn't just cause harm. It takes away all kinds of resources from people, and the impact of it is long-term. Right? I often think about Tatiana Jefferson, Texas, who was killed by the police, whose mother eventually died, whose father eventually died, right? And their deaths are related to the loss of their child, right? So the not just the trauma that your child was killed by the police and you didn't necessarily get justice, but the grief of that, right? Impacts communities, takes away from communities in a lot of ways that are harmful. Affects employment outcomes, affects educational outcomes. All of these things are significant outcomes that disempowers communities, but there are also outcomes that are related to health. There are also social determinants of health. So it's not just get exposed to policing and then, die or develop a mental illness or develop, high blood pressure or mistrust institutions, but it affects a lot of different outcomes in your life that shape your health. And it doesn't just affect you, it affects your community. And I like that Dr. Simkis talked about the intergenerational transmission of trauma and epigenetics and what exposure to stress does to generations down the road. And we really need to think about police brutality as one of those things that cause significant stress and really poor health outcomes down the road for people whose ancestors have been exposed to police brutality. That's a sort of a summary of that.
Dr. Lang, I was going to think about Vanita Browder, Khalif Browder's mom, or Erica Garner. I mean, they're like the good examples. Yeah.
I'm curious about, I know that there are some community-oriented policing models where they're trying to hold community conversations and between police officers and community members. Does that work? Should we be doing that, or should we be doing something else?
Does it work? What works? You know what I mean? The question is, what do you want it to achieve? Do we want it to achieve more trust between a police force and the community it's policing? Does that really help? No. Does it help bring people to a table to have a conversation sometimes? Sure, maybe. The concept of community-oriented policing, a lot of it has to do with getting officers assigned to a beat again. If you think of the old days, the officer walking around with their truncheon, in the neighborhood, and this is the street that they walk, this is their neighborhood. The idea of community-oriented policing is to get officers back into communities and building a relationship with the community as individuals. Does that necessarily work? It doesn't necessarily work. And the evidence is still kind of iffy on that. And we can look to the criminal justice and criminology literature. And, there's a lot of money going into programs like that, but that doesn't necessarily mean that they're working. Same for body cams. A lot of these efforts sound or seem like they are going to be making an impact, but at face level, if we just implement them as is, it's not going to do anything. What we really need to be doing is actually dismantling the structural problems within the policing environment, dismantling the structural institutional issues that go back generations, but that are now being implemented still by officers today, that culture of that warrior mindset that can really infuse officers' behaviors with a sort of militarized approach instead of truly serving and protecting a population. So the idea of cops, community-oriented policing, in my readings and my understanding of it, it's not necessarily the right approach.
I think I would just add, I think there's a nuance I would add to that is that, this is like, if you're thinking of it as a structural problem, this is it. I know this is about policing, so I know we're focusing on policing, but police officers are enforcing laws that are not created by the police, right? So we police poverty, right? We police homelessness. We banish people. There's work coming out of University of Washington, great work. Many people, really awesome people there have helped to create some programs that I think have been really useful, at least in terms of flipping the frame of what are we asking police officers to do? We're asking police officers to be social workers because we have laws that banish people. People don't want to see homeless people in their fancy neighborhoods. And so what do? They call police officers. And so I think there's a way in which this was going to be, I'll probably reiterate this at the end, that we have to, if we're actually thinking about structures, we can't just be focusing on policing, right? Because this isn't just about police. This is about structures we have in place, systems we have in place that criminalize having a mental health disorder, right? Or having a mental health disorder if you don't have the resources to protect you and have family members or other things that can protect you from, being somewhere outside and causing a disturbance that then leads you to go into the criminal legal system. And so while I think we have to think about policing, and I know this is about policing, I think that, like, we shouldn't be passing the buck. I think there's like there's a larger story here about like what, when people are calling the police about a disturbance, like if the disturbance is that you don't want this person, like in the front of your shop or in your, in your neighborhood, we have to think about, what does that mean? Does that mean, I'm not saying that a person doesn't have the right to, you want to sell the things that are in your shop, but then what are the structures that led to a person having to be sleeping in, like, having to be to get like, shelter from the rain in front of your shop, right? So we have to keep, like, I think, we have to keep asking the question, but why? Like, but why are you calling the cops? And like, because this person is in, but why is this person in your like shelter? Because this person doesn't have resources, but why doesn't this person have resources? We have to keep asking the but why question if we're actually going to get to structures, because I think it's just trickier than that. And then we'll just focus on one group. And I think that's like the power of structures. We just focus on this one particular structure, and then we just ignore all the other things that actually matter. And then those things are still operating. And then once you like try to dismantle this, then something else pops up to like control. I mean, so it's just, anyway, this is like my, it's kind of like playing that game from Chuck E. Cheese, where you're like trying to whack-a-mole. It's kind of, anyway, I'll stop talking, but I don't know if Dr. Lang has.
Yeah, no, I 100%, I 100% agree with you, right? I always say that we focus on policing because it's like, it's really dramatic. Like we have all these like viral things that happen, and we are so pained by it. But if you think about the violence that happens in all of our other systems, in the educational systems, in our boardrooms, and like, in the housing system, in transportation, the long-term care system, there's a lot of violence that happens in all these systems. And it's not as dramatic, but it also causes significant harm. And so because the way that structural racism works, that there are all these different mechanisms and systems that would replicate the same thing, that if we hang our hat on policing, like this is a bad thing. And we do that very easily because it's one of the most blatant forms of structural racism. But if we focus on that and hang our hats on that, different things are just going to pop up. Different systems are going to cause the exact same amount of violence. So I often like direct people to how do we address structural inequalities? Then how do we address racism? And then how do we address the white supremacy that actually sustains racism? And so in thinking about like what works for policing, my question is about what policing does, like what are they fixing, and how do we remove those things so that we don't need the police, we don't rely on the police? How do we address these inequities? How do we get to the point where we devalue full communities? We label full communities as crime spots, right? Like we police neighborhoods for people carrying weed. People are in jail for carrying weed. And I work at a predominantly white institution where drug deals happen in fraternities all the time, and nobody polices that. And that happens. Why? The answer is complicated but straightforward: because of white supremacy. And if we don't focus on dismantling white supremacy, every single year there would be a next viral video. There would be a next like let's fix this, but it's just going to keep happening. And so I think that the system of policing is a symptom of white supremacy, and addressing white supremacy is the only way that we can think about addressing the kind of multiple and connected systems of oppression that have made policing what it is today and have causing the health outcomes that we've been talking about.
And if the phrase "we have to address white supremacy" sounds overwhelming, it is. There's a lot of work that goes into that, but part of it is looking at this piece by piece and getting all the right people to the table. That's why right now you have an epidemiologist, a demographer, sociologist at this table, because if you don't have an interdisciplinary lens looking at something this complex, there's no way you're going to start to find those solutions. And one of the things that folks sometimes don't like that I say, but I'm going to say it anyway, is we aren't going to change the police without the police. And so that also means learning how to have communications with people in law enforcement about what's working, about what's not working. So, Dr. Lee, you mentioned that, and actually, Dr. Lang, you brought it up as well. What are our law enforcement officers doing? If you talk to leaders in law enforcement, they'll tell you they're not social workers. They're not trained how to give naloxone if somebody has an opiate overdose, or at least most of them aren't. They don't know how to handle when there is a tremendous amount of homelessness in a community. They don't have the training and they don't want to do the work, but they are told that they have to. They are the frontline people who get called. So by removing things from their plate, giving it to people who have the trained skill sets, we are also allowing law enforcement to zero in on what they actually need to do. And then they could work on getting that part better while we work on fixing those other problems using other structures and other systems.
So yes, we have several people who have asked more specific questions around what do we do? How do we help? How do we change this? And Dr. Simkes, you were saying larger structures and smaller structures, but are there any steps that I, as a person living in Portland, can do to help?
So because I talked about addressing white supremacy and dismantling white supremacy, I think that the racism that we see in policing is the racism that we see everywhere. I think when I think about what an individual can do, right, it's like I always say the only person that you can change really, and for sure that you can change, is yourself. And so one of the best things, and it sounds difficult, but also easy, is to think about in your own small world, in your own sphere of influence, how do you sustain racism, right? How do you sustain racism? How do you sustain white supremacy? What are the everyday actions and everyday choices that you make in the moment to interrupt white supremacy and racism in real time? We all want to change policing. I mean, we all want to change the United States. We want to change the world to make it more just. It's not going to happen if we cannot change our offices, our dinner tables, like the little things that we have control over. Being able to humanize groups of people, see them as people, it's really important. I also think about, being able to take risk. The unfortunate thing about policing and about structural inequalities are that communities that are harmed the most by these systems are the communities taking the most risk to bring change. And I think that people who are white, people in positions of power, should be able to take risk. And taking risk means, think about the time when somebody made an assumption, right, that a police officer could have easily made and killed someone. Think about the time when something happens that it's racist, or a racist joke, or whatever, or a racist policy. And think about what prevented you from interrupting in real time, right? That is the thing that actually sustains racism and that actually sustains white supremacy. And so think about like taking the risk, think about letting go of that thing that you benefit if you don't speak up, that thing that you benefit if you're just quiet and you let things slide because you don't want to interrupt. Those are the things that reinforce that groups of people are not valuable. Right? Not valuable, not just in the sense of that they'll be killed by the police, but not valuable in the sense of having access to resources, or people caring about what's happening in their neighborhoods, or people caring about their mental health. Listen to them, or teachers K through 12 respecting them. Right? And think about just think about the people that you know. Right? Everybody was really mad about George Floyd, and I said to my colleagues, and they hated me for it, but it's what it is. I said, how many of you know of a potential George Floyd? How many of you know a potential Breonna Taylor? Who are the people that you have close relationships with, that you really know them, that these are just people. Like, so think about your networks. There are all kinds of things that I can say, but I'm gonna get off my soap. But I think that we cannot change the big things when we cannot change the small things. It's really easy for a lot of us to be in spaces like this, show up at rallies and protests against police brutality with people who believe similarly as we do. The challenge comes when you're in the midst of, among people, family members, friends, people that actively don't care about inequalities, don't care about racism. That is your moment to shine. It's not when you're with everyone else on the street. That's your moment to interrupt those jokes, like your own area of influence. Like, think about how you want to get that just first. And I guarantee you that it's going to, eventually we can all change the bigger systems. But sorry, I get off my soap opera now, but yeah.
Dr. Lee, do you have any, you're fine. Do you have any comments?
I would just say, similarly, maybe a little bit sort of expanding out is thinking about your local politics, like what's happening at your state, within your city or county, are really important. You can make a lot of change within those places. And so thinking about, if you're not already involved or in neighboring communities, and also, I think as Dr. Lang was saying, talking to individuals, I remember talking to a colleague who wanted to change the name of her child's elementary school, and was working with a group of other parents in their community to do this. It was kind of a well-to-do community. And they went to other communities and were, wanting to talk to the leaders of those communities and say, like, you should change the name because the name is like representing, structural racism. And then the people in those communities said, that's great, but we are like trying to get enough books, and like we're trying to make sure the students in our school are getting, the nutrition they need. And so I think just having those conversations, as Dr. Lang said, can really help you. And also talking to community members, because I think we always think we know the solutions, like, I read the 1690 Project, I know exactly what to do in this community over here. No, like actually talk to people from community, like talk to the community, like people have knowledge they can share, and they can tell you what needs to be done. And so, be a humble participant too, because I think a lot of us who have a lot of privilege, and including, professors like us, think we always know what the answer is. And sometimes we are just completely wrong about the needs of a community. And even perceptions of the police in communities, from what we read, we have particular ideas that may not align with what happens when you actually talk to communities. So just do the work, I think, is important too. Just don't make assumptions. Yeah.
So Dr. Lee, you talked about community, understanding politics and sort of the bigger picture in your area. Dr. Lang talked about those relationships and the people in your sort of sphere of influence. I'm going to zoom in even closer and talk about internally in the self. It is so important that in every opportunity you pause and think about what are the privileges you bring to the table, that you look with curiosity at yourself and your own assumptions. You look at your own preconceived notions, your own experiences, and you ask yourself and really kind of follow the but why, but do it in your own head. Why do I think that? Well, why about that? Well, why about that? Because ultimately it will help you understand some of your own deep-seated beliefs that may or may not be where your values truly lie. And for you to be able to have these conversations with other people, to support politicians and be vocal on social media or whatever you want to do, you have to understand where you're coming from as an individual as well. So thinking with humility and curiosity about yourself is kind of the first step before you can even have those conversations with the people around you and with the people in your community. So start inward, do some reading, do some learning, and do some self-reflection.
That's a great segue into another question from one of our attendees. Actually, a couple of questions, but what are some of the best resources to educate ourselves about white supremacy culture, and how do you make sure that they're legit and trustworthy?
Wow. Okay. Well, first and foremost, read works by Black authors and Brown authors. Start there when it comes to understanding white supremacy, because it is really hard to take a lens and focus it in on yourself. And so to learn about white supremacy, I always go to the people who ends it, and not in the beneficial way. Some of the authors that I really like to read, Ibram Kendi has some wonderful books that are really a great introduction. I'm also in the process of reading Mediocre by Ijeoma Oluo, which is also a really important read around sort of the mediocrity of that mediocre white man. And what is that history in the United States that has led to a white supremacist culture built on the idea that just being a white man, you can get by and do great, but everybody else has to work quite a lot harder to get there. If you're not familiar with Michelle Alexander's book, The New Jim Crow, or the documentary that kind of accompanies that, 13th, I highly recommend starting there as well. to learn more about policing, honestly, there's a really easy read by Radley Balko. And by easy, I mean it is written by a journalist, not that it is a light read, called Rise of the Warrior Cop, that will introduce you to the full history of policing within our human society from early Roman times until now. So those are just a few off the top of my head.
Dr. Lang or Dr. Lee, do you have any other recommendations?
I think, I'm a social scientist, but I think some of the best work to really understand the human condition, in addition to what social scientists bring to the table, are what humanists bring to the table, which, we don't often talk about, which a lot of social scientists don't talk about, but it can be really important. So people like Charles Mills, he just passed away, but he's an amazing sort of ethicist who's talked a lot about white supremacy. He's written beautiful work. So read anything he's written, it's all great. Talks about the ways in which sort of thinking about racism and environmental discrimination and the ways in which those intersect. He's done a lot of work on that. Even reading writers like Desmond Ward, she won the National Book Award. She wrote a book called Men We Reaped. There's a lot of really great books about the human condition that can give you, I think, really important insight into sort of like how, thinking about the human condition and the ways in which inequality sort of operates. I'm sure Dr. Lang has others, but those are some individuals. Oh, I just mentioned Charles Mills. Sorry, I saw the question there. So Charles Mills has written, anything he's written is great. So I would, check that person out. Yeah. I don't know if Dr. Lang, you want to add more?
If you're interested in sort of, like how racism, white supremacy, but mostly racism and some of the impacts of race, because when we think about racism, it's the system of it, but the different structures within which racism plays out and how it shapes people's outcomes. If you're thinking about mass incarceration, read Dr. Lee's work, sitting right there on mass incarceration and health outcomes and people who have a history of incarceration and health outcomes. Think about those connections. If you think about there's Andrea Smith's work, she's written on white supremacy and racial capitalism and heteropatriarchy, sort of how the foundation of the US and how those things are interconnected. And then, I think your best teacher really is people. Like, interact with people and learn from people's experiences and ask people to share their experiences. And when you ask people to share their experiences, believe them when they share their experiences with you. Don't then, doubt them, because we all have experiences that other people don't have, because of the color of their skin and the lifetime of things that they face that you don't face. And so one of the things that I get really tired of in these conversations is having people of color share their experiences and then people not believing them, or people thinking that that's not necessarily, if you ask people about their experiences, so if you invite people to share with you about what works and what is not working, believe them. You can learn a lot from creating real relationships with people than you can from reading in the book. I have a primary care doctor that I work with, who's the director of a federally qualified healthcare center that serves people that are impoverished and unhoused. And she's an amazing doctor, but she always says that healing happens within the context of relationships. And I think that it's the same thing with racism and understanding white supremacy, that you're better off having real, authentic relationships with people, pushing yourself out of your comfort zone than you would from reading a book.
That being said, also Eduardo Bonilla Silva's book, Racism Without Racist. Gotta read that book. I mean, it's a great book because it taught, whenever we think about racism, we're like, oh, there's a racist person. And that book, I really think kind of unpacks that. And then if you want to read some historical stuff, W.E.B. Du Bois, like for especially the Philadelphia people here. Yep, see that book. I have it here too. W.E.B. Du Bois, The Souls of Black Folk, I mean, is another great book. The Philadelphia people here, I mean, look, he was at Penn. They didn't give him tenure. I mean, he's like one of the most famous sociologists in the whole world.
No kidding, man.
And like, you know, I mean, I think so. And anything after he got over his talented 10th phase. So like Dark Waters, he has other books. And you'll learn about that if you read about him. Yeah.
So go ahead.
I just wanted to add that this author has an article that I assigned it for my class, and we talked about it yesterday. And the title is "What Makes Systemic Racism Systemic." It is really, really good. Like, it talks about how we get hung up on the person who's racist and ignoring like a bunch of other things. So thank you for he's a really good person to read about these issues.
Yeah, he's awesome. And watch any video of him too. He's a great presenter. He doesn't play. It's really good.
Can you repeat the name of that author?
It's Eduardo Bonilla Silva. Well, so it's like Bonilla Silva. Yeah. He's also Puerto Rican, so.
So you're all. I'm gonna just add one additional resource. There's a video that I typically use. I didn't use it this year, but Raise the Power of an Illusion. There are 3 episodes. They are really, really good. One talks about the origin of race. One talks about how we created whiteness and white supremacy. Eduardo Bonilla Silva is in the video as well, and really, really talks about like how you recognize these things in real time, like how you recognize white supremacy and racism and what it looks like. So it's called the Raise the Power of an Illusion.
Yeah.
So I see that our volunteers are frantically copying down all of these titles and things that you have referenced. So we'll have those. And then we'll also post some of those over the next couple of days on our social media. So if you missed any of those, folks who are watching, you can check back with us on that. I want to ask one more quick question, and then I want to do our final question. But the quick question is, what's the best way to go about asking people to share their experiences? And this may not actually be a quick question, but the audience member says, I'm always nervous to bring up something traumatic for people. What are your thoughts?
Always be traumatic, because racism is traumatic. And there are lots of schools of thought about like asking people to share their experiences, because first off, like, you should do your own work. You don't want to have us share experiences and bleed at the altar for your learning, because sharing our experiences is traumatizing. So I get the worry about that. But I think you want to do that in a, you know, you can't just meet a person the first time or someone invite people to share their experiences. Again, build relationships. Once you've built relationships, those things would be more natural. You'd ask, and it's okay to be nervous. Really, you're going to be nervous, and like, you'd make mistakes and you would cause harm. We all do. I mean, I've had students tell me, Dr. Alang, we just want to challenge you to think about how you're enforcing white supremacy. And I, you know, that's why we call some of this like unconscious, because you don't see it, and somebody has to tell you that this is what you're doing. And so when you feel uncomfortable, it shouldn't stop you. It really shouldn't stop you. You should be okay with that and push yourself, but also recognize that you want to learn, but do it in the context of a relationship. Just think about building a genuine relationship. The rest of it would be easy. And even when you make mistakes, you bounce back. We understand when people make mistakes, and we understand when people ask us hard questions. We understand when they want to learn. We understand when they don't. It's people just know. I don't know, Dr. Lee, what do you think?
I think that we have to also, I think in terms of being internal, like, who are your friends? Like, who are the people that you're really close to? What do they look like? What are their life experiences? What are their backgrounds? I mean, that's kind of the first step, because I do think that these kinds of questions come from, you know, closer relationships at times. Like, you shouldn't be so extractive. But like, you know, it's not cool to be like, okay, I'm going to have a dinner party. Like, I read Jasmine Ward's book, where she's like bearing her soul about all the people in her life who have died due to like inequality. with a whole bunch of other privileged people, great. Like, do those conversations too. There's important, but like who is in your network? Who, like, where do your kids go to school? And who are the people that and if you do go to a diverse school, who do the kids you end up hanging out with too? I mean, like, ask yourselves those questions, because I've definitely had people want to know my experience, and it feels like very touristy, and I don't think that's cool. But people who are my close friends, I want to share, like, they're my friends. So, just make sure you have cool friends, diverse friends. Inclusivity is excellence, anyway.
So as my final question, I would like to ask all three of you to answer for yourselves, obviously. If you could have our audience remember only one thing from this conversation, what would that be? And I'll start with Dr. Erlang.
Just remember that you do have power to make a difference in your own, like, sphere of influence, and it's not a short process. It's going to take time, and that's okay.
Dr. Simkis, what would you say?
I'd say that I'm going to build on what Dr. Lang said. Not only is it in your power to do good work, but it is also your responsibility to borrow words from a very well-known and very important former congressman, to do good trouble. You need to make good trouble.
And Dr. Lee, do you have any words you'd like to make sure we remember?
Yeah, they're two separate ones. First is social scientist. We are scientists, and it's a different kind, it's a different kind of data, and maybe not what we think about when we, watch, TV or those kinds of things, but we have a lot to share, and you can learn a lot about the world. Things that you think you don't always know. And social scientists can tell you that. And then two, you're probably going to hate this, Amanda, I'm going to end it this way, but this panel isn't about just policing. This isn't about policing, right? Policing is just one of the many things we could have talked about that, like, impact our communities. This isn't about, like, the punchline of this isn't like, okay, let's just like only talk about policing. This is the root cause of all problems in society. That's not the case. Like, policing, certain dimensions of policing are a reflection of, other systematic issues that we have not dealt with in our society, including inequality, including racial residential segregation, including not recognizing the histories of slavery that are foundational to our society, including thinking about our interaction with immigrant populations, and the list continues. And so I don't think we should end this by just thinking about, if you just end this with being like, okay, policing, this is what we have to fix, then that, I don't think we did a good job in this panel.
I think that's not great. I don't think the situation is great, but yes, I fully agree that this is a much bigger question, and that I'm glad we got into all of that as well. So thank you for that. Any final words before we wrap up?
I'll just say, don't be afraid to do the learning and to look internally. Don't be afraid to start having the conversations. It will be uncomfortable, as my colleagues here have said, but discomfort is a good thing. Discomfort is where you learn. Discomfort is where you grow. And learning how to be the person who stands up in the room and says, hey, that's problematic, or I want to recognize my own bias in what I just said. That's hard to do, but it is important work to do. And there's everything in your power. You have it in your power to actually step up and be a force for change. And as my colleagues have said so beautifully throughout this talk and throughout this panel, there is so much more to this than just policing. And you don't have to start with policing in order to do this work. In fact, it's probably better not to. But we come to this work from all different places, and that is fine. We land in the same place, which is we need to do quite a lot of work as a society, as a country, and as individuals to dismantle some of those structural, historical, emotional injustices and prejudices that we have. And as we do that, we'll start to build a better place for all of us.
And this isn't fuzzy stuff. This is facts. Like this is like Bayesian modeling. This is not, you know, these are not my feelings. This is just these are like facts that have come from administrative data.
Yeah.
So
you are a demographer.
Yeah. Look to the data. We all love the data.
Yeah, I have, you know, nothing to add really. Just day by day, make an effort each day. Say to yourself, you know, how have you challenged racism today, and build relationships. Who's around you? Who are your people? Who are the people you're around with?
Well, this has been amazing. I want to thank all of our speakers, Dr. Hedy Lee, Dr. Siri Alang, and Dr. Maayan Simkes. Thank you all so much for joining us this evening. I have learned a lot, and I hope our audience has as well. So thank you for being here.
Thanks for having us.
Just as a final little thing, I want to say thank you all for coming and let you know what's coming next. Our mid-October event, we've had to reschedule, but the next one will be on Tuesday, October 26th, on a completely different topic. Well, I guess it does sort of have to do with law enforcement. Anyway, but it's Mary Roach. She's an amazing author. She's hilarious. She's wonderful. She's a fantastic science writer. Really excited to have her back. We've had her here before. And she's going to be talking about her new book. So please join us for that event on Tuesday, October 26th. And want to say thank you to the folks, our many Patreon supporters. You are all wonderful. Thank you for doing this. You are helping support us being able to do these events. These are the folks who are donating $10 or more per month. Thank you. And we couldn't do this without you. And then speaking of, here's just a quick little donation site or information. If you want to join our Patreon, there's a link there. We, our nonprofit partner, Make You Think, you can make a tax-deductible donation through them to help Science on Tap, and your ticket sales also help with that as well. So thank you all for coming, and we're going to be sending out a survey. Would love to get your feedback on the event as well. So thank you all. Have a good evening.